Hey everyone, welcome to this month's Clinical Corner. I am joined by Betsy, our clinical RN, and we're going to talk about floating 101 for our travel nurses. Betsy, why don't you start us off with some safe travel tips while floating?
Sure. I think one of the most important things you can do with floating is before you even accept an assignment, ask really detailed questions to find out which units you could potentially be sent to. And sometimes they'll give you an answer that they'll send you to only like units or similar units. But you want to know exactly which units they are because that could be subjective. So get that established and then make sure you have it in your contract so there isn't any confusion later.
Yeah, absolutely. And what should travelers do if they are floated?
So the first thing you want to do if you're floated to a new unit is ask for an orientation or a tour of the unit so you know where things are. Ask who your go-to person is, who can be your resource, who you can ask questions throughout the shift. And then also when you're getting report, listen really closely. If they're trying to give you a patient that has some kind of treatment or a drip or something that you're not comfortable or familiar with, ask about that because you may want to speak to the charge nurse or someone else to see if you can get it reassigned or placed with someone you're more comfortable with.
Yeah, absolutely. And then like we're in a crisis right now, what are some things they should do floating during a crisis situation?
Yeah, it can get really sticky when you're in a crisis situation. It's kind of all hands on deck. So it's pretty common that nurses, especially travelers, will be asked to float to a unit that's outside of their specialty area. We do allow for that, but we only allow you to do tasking on that unit. So that means supporting the primary nurses with their patient assignments. So you can do things like start an IV, place a Foley, draw blood, things like that. But we don't want you to take responsibility of the overall care management of a patient that is outside of your specialty area.
And what if a traveler has concerns while they're on assignment and they are called to float and they're not for sure? What's the best practice for them to do?
Right. So what you can do is, first of all, have a really professional conversation with the charge nurse or the house supervisor, whoever is assigning you to this other unit, and just really talk about what your concerns are and why you don't feel comfortable. Sometimes arrangements can be made. Sometimes they could send you to a different unit than they thought they originally would, where you're more comfortable. So just have a professional conversation about it. If that doesn't work, you can always call your RES account manager or recruiter. We can give you support and help guide you through the situation. And also, it's always important that if you do already accept a patient, that you don't leave because that could be considered patient abandonment.
Okay, awesome. Well, thanks so much, Betsy, for your time and insight today. I really appreciate it. If you have any questions or concerns, please comment below or contact your RES recruiter.